gatherings of more than 500 people in Scotland should not take place from today to help ease the burden on the emergency services during the coronavirus outbreak.
Professor Jason Leitch is the National Clinical Director for the Scottish Government. I'm delighted to say he joins us now from Glasgow this morning. Thank you very much. I know you're a very busy man at the moment, so we appreciate you spending a bit of time with us this morning.
Good morning.
Can we talk about those sort of mass gatherings of 500 people to be cancelled? And just talk us through the thinking of why that's being implemented at this stage.
So we're not doing this for public health reasons. You've just had a very good set of advice from your business correspondent about what people should do if they have symptoms. That's the principal advice across all 4 UK countries. So if you have a cough, a new consistent cough, and or a fever, you should stay home. The mass gatherings thing, which we decided to implement in Scotland at the end of last week, beginning today, is really to free up NHS resources. So we're going to need all we can get. This is not going to be an easy few months. So the paramedics, the ambulances, the doctors and nurses. So we've decided that any mass gathering over 500 that needs NHS resources won't happen from today.
OK, can I also ask you about school closures? Because this is a question we're getting an awful lot. And it seems to be, from those who listen very carefully to what was being said at various press conferences last week, at some stage those school closures look like they will happen. Why not implement that now? What's the thinking behind that?
So there's no plans for mass blanket school closures in any of the 4 countries. And we're trying as much as we possibly can to make these decisions UK-wide. So the clinical advisors, the 4 chief medical officers, me and others, and the politicians have had remarkable consensual conversations about trying to move all 4 countries together. There are exceptions to the school closure rule. You'll notice that Shetland has closed its schools today for a week. And that's a resilience challenge, not a public health challenge. That's about staff members having symptoms and being off, and Shetland having a particular small workforce. The challenge with schools, Dan, is that if you close all the schools, somebody has to look after the kids. And that will be police officers, people who are in police control rooms, it'll be people who man the treble 1 hotline for us, and it'll be frontline workers inside our hospitals and community practices. Now, we're not doing that at the expense of the kids being harmed. This virus is very, very mild in the vast majority of people, and in particular in children. So we're not taking a risk with children. We think that keeping schools open just now is the right thing to do for the science.
I know a lot of what you're saying is trying to reassure people, and I'm also aware that you're probably reading the same sort of stories that many of our viewers are reading, where I saw over the weekend, I saw yesterday an article in one of the newspapers saying doctors and scientists urge the government to stop ignoring strategies from other countries that have brought cases down. So can you please this morning offer a bit of reassurance to those who might be asking that exact question, saying, why is the UK taking one particular route when we look across at Europe and see other countries who are doing things very differently and are seeing a reduction in some of their coronavirus cases?
Let's remember that the WHO is responsible for 194 countries. So the advice that WHO gives has to be applicable in the Maldives, in Somalia, and in the United Kingdom. So it's no surprise that when that advice reaches Somalia or reaches Scotland and Wales and England and Northern Ireland, that there is adaptation to that advice and guidance. And Scotland's healthcare system and the UK's healthcare system looks very different from the healthcare system in other countries. So we're making choices based on our demographics, our geography, our care systems that we already have in place about what's best for 2 things. Care of the individual. So we want to have the best care possible for each individual person. So that means increasing intensive care capacity, making community care different, but also the care of the population. These are 2 different things. So caring for the individuals, like I used to do when I had a proper job as a surgeon, was one thing. But caring for the population as a whole is a whole different thing, and requires really difficult decisions to be made with the best science we can. That's why each country will be slightly different on its path.
OK, there's 2 quick questions I'd like to get to. I know these are sort of quite difficult things to do briefly, but if you could. The UK government, again, speculation about asking potentially over 70s to self-isolate within the coming weeks. You tweeted yesterday, I was looking at your Twitter feed, saying that Scotland has no plans to do that. What is the thinking around particularly the sort of older generation?
So again, we're trying to do this for UK countrywide. COBRA will meet later today, taking advice from me and many others. What we will probably move to in the next while, weeks, is that we'll ask over 70-year-olds and those with pre-existing conditions to cut back on their social contact. The last thing we want to do is put the elderly in rooms by themselves for 3 or 4 months. This is a long haul. This is not going to be done by Tuesday. So there will be a point where we ask the elderly and or those with pre-existing conditions to cut back social contact. So I got a little bit of trouble in social media yesterday for saying that'll be bingo in pubs. But they were just examples. The very fit 70-year-olds all told me that they don't go to the bingo anymore. A lot of people do go to the bingo. And that's a social area and we're really reluctant to pull people back from these social occasions, mosques, churches, pubs. But there's going to come a point where we're going to probably have to do that.
And can I ask you finally, I mean, how much are you sort of fighting against those sort of amateur virologists and those who've become experts in epidemiology over the last sort of 3 or 4 days with the sort of official advice? And because I think social media can play a very positive role at times like this, but also it can cause the panic to spread quite easily, can't it?
So we're trying to create some kind of balance in there, Dan. You're right. And I, amongst others, are trying to communicate as best I can with the public. I've only pulled out my Masters in Public Health line once, and it was 10 minutes ago with Piers Morgan on your competitor. So I did have to say, I'm not sure, Mr. Morgan, where you got your Masters in Public Health. I don't like doing that, but there comes a time when the amateur epidemiologists in the country are not helping us. I'm very happy to be held accountable. I'm happy to answer questions as much as I can. And Scotland, frankly, in the last few days is fed up with me answering questions, totally honest. But I think there's a point for following the expertise. And that's the scientists who are helping us inside to give advice to COBRA and others.
Well, we really appreciate you sharing some of your expertise with us this morning, Jason Leitch. Thank you for your time, and hopefully we'll speak to you again soon.
Talking about expertise, 8:10, as many of your questions we can have answered with a special expert panel right now. The news